What can I do procedurally? Remember, these are patients whose medicines have failed. What can I do procedurally when I have a very large prostate? And really, that comes down to two things. If you're going to fix that patient, you're going to, well, I'm going to say three things, but in 2023, really, let's talk about two things. The mainstay has always been an operation called a simple prostatectomy that's done through an incision. And what we're doing, in essence, I describe it as if you get a really good navel orange, you're trying to separate the peel from the pulp. And you can find this plane in between the two and shell out the pulp. And it's that pulp that's been blocking the man. That historically had always been done through an incision. And as with most operations, that's been now moved over to the arena of robotic surgery. So very few people today are going to offer an open surgery for that. It might be offered, but generally you would want to seek out someone who does robotic surgery to do that. Now, there's an endoscopic procedure that has been developed that is a competitor to the robotic simple prostatectomy, and that's called a HoLEP, a holmium laser enucleation of the prostate. And very recently, even, there was a sort of a pros and cons and a point-counterpoint discussion in there from experts in the European Journal of Urology, which is probably our #1 journal, where there's really no clear winner. And I've had many patients. Of course, I do a lot of robotic surgery. I'm expert. I would consider myself an expert in a robotic simple prostatectomy. And in my hands, that goes very well and very smoothly. But I always tell patients I would be just as happy seeing them do this HoLEP procedure. There's pros and cons. Both procedures are very user dependent, meaning they have what's called a steep learning curve. It takes a long time to get good at either procedure. And both procedures are considered minimally invasive. One is through your penis, one is through your abdomen. And as I said, it's really a pros-cons discussion. One might have a little more blood loss than the other. One may have more scarring or other complication than the other.